What's going on, everyone? Happy Tuesday. Hopefully everyone is doing well, staying safe, healthy, having a great day so far, and hopefully you are testing negative for all those viruses. It is time now for the Tuesday edition of the Virus Update for Tuesday, August 26th, 2025. If you are new to my channel, welcome to my channel. This is where I do the daily virus update on all those viruses that can make us sick. Let's face it, there's a lot of viruses out there, and you need to be informed of what's going on with these viruses. That's what I do here on my channel each and every day. If you want to stay informed of what's going on with these viruses, just subscribe to my channel down below, give this video a thumbs up, hit that notification bell, and share this video with anyone you know. Already, we do have several news stories to talk about today, including measles, as you can see here. Plus, we do have some new emergency department visit data from the CDC for COVID. We need to take a look at that as well. There are some concerns. Some things that don't normally happen are still happening. I think it'll make sense to you when we get to that. And we do have some other things to take a look at today as well, including a couple surprises. Yes, one thing we have not looked at in a very long time, and something else I don't think we've ever looked at before here on the channel. So we'll get to all of that. Starting off with this, with measles. Alabama reports its first measles case in more than 20 years. And this is not a good thing at all. A child in North Alabama contracted the nearly eradicated virus. The Alabama Department of Public Health said a child under the age of 5 got sick while traveling out of the country. I said it before, I'll say it again. I think we are slowly penciling in every state. And if we don't, we're going to be pretty close to saying every state has had at least one case of measles, because we're not far off from that at this point. And now Alabama reports the case, and you know how it goes. Hopefully one does not become two. Sounds like this was due to international travel. So yeah, that's a story we've heard all too many times. Up in the state of Washington, Spokane County resident presumed to have measles following an exposure. Yep. So yes, another potential case of measles, this time being Washington. It says, though test results have yet to confirm it, a Spokane County child has almost certainly contracted measles, according to local health officials. The first case of measles in a Spokane County resident this year. The presumed diagnosis comes after two cases were identified in North Idaho earlier this month. One of those individuals traveled to Bonner County to Providence Sacred Heart Hospital in Spokane to receive treatment before they were diagnosed. So yes, measles continues to be an issue here in the United States and other places as well. We should get a Canadian update later in the week. Over in Chile, they suspend Argentina poultry imports after detection of bird flu case. Yes, bird flu is still out there, and you know, I have a list of things that I search. Now, I don't search every one of these things here on the list daily, but I try to, at least throughout the week, go through as many of these as possible. And bird flu, I figured, yeah, I haven't typed that in a while. And sure enough, this pops up. Who knows? We may have even missed some things. We do have a tracking thread. It's over on our website at datareport.info. I had forgot to add all the bird flu ones over to the new tracking thread section. Did that yesterday. They're all moved into the spot as well. And, of course, I had to add this. All right, moving on. Alabama coming into news once again, but not for a good reason. This is just totally ridiculous. We often talk about traveling, how it can be risky. It's been a while since I've mentioned that, but we have touched on that before. And you just never know. Is the person next to you going to be sick? Well, get this. We've been talking about norovirus popping up in hotspots lately. This is not helping things. Alabama mom deletes her TikTok channel after defending her choice to board a Disney flight with the norovirus. We are supposed to feel badly for her? Heck no. Heck no. And I had to look. Okay, is this just a random Joe Schmo report? Well, no, there were several other news stories on this, so I said, okay, I guess we'll share this today. 4 vomiting family members. 3 modes of transportation. And now I deleted TikTok account. Apparently, a lot of people said, whoa, you should not be doing this. What? What were you thinking? You could risk getting other people sick. Yeah, hello, hi. if you are sick with norovirus or any other virus, I'm sorry. You should not be traveling in public, even if it's just a cold. And if it is just a cold, okay, and you still decide to travel, could you at least do us just one favor and just wear a mask on the plane or something? I mean, you're risking getting other people sick, and yeah, viruses can transmit. Norovirus can transmit very easily, and yeah, I'm just looking here. Yeah, I'm not feeling sorry for this person whatsoever. They should have not done what they did. Alrighty, moving on. Emergency department visits diagnosed with COVID. We got a problem here. We're going to look at this twice. We're going to look at this from sci-fi, and then we're going to go to the actual page a little later in the video. We'll come back to it. The CDC reports U.S. COVID emergency department visits for ages 0 to 11 at levels unseen since August 31st, in other words, of last year. As of August 21st, Texas, Florida see 0 through 17-year-old more affected than older groups. California also sees an increase. Hawaii likely peaked. When we talk about 0 to 11 years old, back to school is happening, but that age group has been rising prior to back to school. So back to school is only making it worse, especially as you get closer to 11 years old. 0, you're not in school yet, but over 5, 6, 7, 8, 9, 10, 11 years old, preschool and grade school, yeah, that it is a thing. And Florida is doing oh so bad. In just a little bit, we're actually going to take a look at Florida and some other states. All right, I have to share this with you. Petra Kvitova, I hope I said that correct, had COVID just 3 weeks ago and is still not fully recovered. We've heard this time and time again. Admitted her lungs aren't fully working yet. And get this, yes, she wanted to finish playing her season with a Grand Slam. Not because the COVID caught her, but she just wanted to finish out the season. So, yes, we found out of another person, this time in the tennis world, who has had COVID. We're finding out of a lot of people who have had COVID lately. My list of names I need to add, it's double digits. There's a lot of names that I need to add to the archive. One of these days, I promise, I will get to that because, as you know, I like to document I like to keep an archive, a history of what's going on. All right, in New Jersey, just going to read a headline here. Montclair Animal Shelter, temporarily closed due to COVID outbreak. This is in North Jersey. I have actually been to this town before. Believe it or not, well, you know where I live, Philadelphia. Believe it or not, an Uber ride took me up to North Jersey, and I continued up there and ended up in this town one time. Yes, an animal shelter is dealing with an outbreak. There is not enough available staff to clean and feed the animals. Until then, administrators said our animal control is always available for Montclair residents at blah, blah, blah number. But you get the point. They're temporarily closed because of a COVID outbreak. You don't hear about this too much publicly anymore. Do they still happen? Sure, they do. You just don't really hear about them in the news all that much anymore. All right, taking a look at the website. Is there anything I want to show you today? Well, here's the tracking threads. There's 13 total. I don't know. Did I miss any more? I don't think I did. If I did, I will move it to here. But you can see here's all of the tracking threads. You can see we added to the measles, and we also added to the international, the bird flu tracking thread, the international one. And I'm sure sports illness, something will pop up sooner or later because that looks to be, other than measles, that's our second biggest threat when it comes to number of posts. It's crazy how bad it's been for sports players, and it's not going to get any better. We'll probably easily pass 200 replies in there before the year is done. All right, moving on now. Let's take a look at Canada. Let's refresh this. The viral activity level for COVID-19 is moderate. Flu A is low. Flu B is low. RSV is also listed at low at this time. Let's take a look at air qualities. They're really bad in the West Coast again today because of ongoing wildfires, and eventually this will load. Yeah, you can see the East Coast. Not bad. The West Coast, the Pacific Northwest, you see maroons here, you see oranges, you see reds. Not good whatsoever. Wildfires are the reason for this. Taking a look at what's going on in Pinellas County, Florida, and we do need to refresh this, make sure it's up to date. And I am seeing breathing problems show up multiple times, seeing sick persons show up multiple times. Yeah, they're still dealing with the COVID. Look at that. 1, 2, 3, 4, at least 4 sick person calls going on right now. And breathing problem is showing up, yeah, a number of times as well. That's not good. COVID, it's still a problem down there. It peaked once in Florida. This is Pinellas County, Florida. It peaked once, and then kaboom, it went back up again. And you're going to see that in emergency department visits in just a moment. 835 EMS incidents in Philadelphia on Monday. That's above 800. That's not good. Whoa. What is with all these calls? Look at this. 22 active EMS calls. It's 12:43 in the afternoon. 22 active EMS calls right now in Montgomery County, Pennsylvania. That's really busy. Was not expecting that. What I was expecting to see was Chester County really busy, because that's been busy all morning. And let's see, is it still the case? I got a few. Oh my goodness. Look at all these EMS calls. Look at this. Stroke once, stroke twice, stroke 3 times. How many times we had a sick person? 1, 2, at least 3 times for sick person. Respiratory difficulty is showing up. Wow, this is not good. I mean, the Northeast continues to rise. We're going to look at wastewater in a few minutes. Let's take a look at EMS census. That was not from today. That was from yesterday. I forgot to look at this earlier. Just a few things going on in Bucks County. Don't know why road closure comes up in EMS. Okay, I don't know. Every county does things different. That one makes no sense to me. Let's take a look at the hospital situation in Pennsylvania. Wellspan, Gettysburg. Overcrowding. Informal. Let's see here. Emergency department overcrowded with multiple holes in department. A full waiting room. That's not a good thing. EMS will have extended wait times. Oh, that just sounds like an utter disaster. Mind you, folks, we're in August. This is not cold and flu season. This is August. Look at this. Paoli Hospital. Or it says Bryn Mawr Hospital. It's Paoli Hospital. Crowded emergency room. Expect prolonged wait times. Lankenau Hospital here in southeast Pennsylvania dealing with problems. And I did see some Lehigh Valley hospitals today. A couple of them. St. Luke's Bethlehem dealing with problems. There's another one. Can we get it? Here it is. I believe it's over in St. Luke's Anderson dealing with problems. And take a look at this. St. Luke's Monroe is emergency department near capacity once again. Oh, we got another hospital up near Jim Thorpe. Emergency department overcrowding. That's not good there. They actually have 2 hospitals in that area. And the fact that's happening is, actually, look, 1, 2, 3 hospitals there. And still, one of them is overcrowding. Yikes. That's not good. All right. It's Tuesday. Normally, we would take a look at what's going on with Pennsylvania wastewater. Can we? No, we cannot. But we can at least take a look at what is going on with emergency or hospital visits. Let's see here. As of the 16th, and I believe this is behind too. 292 adult patients for COVID in Pennsylvania. Pediatric is at 22 at this time. This is as of August 16th. That's last week still, so that does need to update. This is new, or at least new to us. I didn't know this existed. I saw this on the PA wastewater page, a link to Erie County, Pennsylvania. So take a look at this. Here's a COVID-19 wastewater surveillance for Erie County, Pennsylvania. And you can see here, yes, there is a little bit of an increase for COVID in wastewater at this time. And it does say August 18, 2025. So that's pretty recent. Moving on now to New Jersey. We need to refresh this. And let's see if there's any hospital issues there today. Inspire Medical Center, Mannington. Specialty issue. Inspire Medical Center, Mullica Hill, full and total divert issue there. And now let's see if New York State updated for today. If it did not, that's okay. You're going to see yesterday's numbers, which we did not show on the update because, well, they were not in yet. 419 positive cases reported yesterday. And we do have New York State, August 22nd, 363 hospitalized, 47 in the ICU. This is to finish out last week. We will show you today's numbers and maybe tomorrow's numbers tomorrow. And the wild card is, will New York State continue to go higher? One would think that they would continue to go higher. All right, something we have not looked at in a long time. Chicago's dashboard. Now, mind you, this has not updated since last week. Emergency department visits for influenza, minimal. RSV, minimal. COVID-19, minimal. However, take a look at this right here. Yes. COVID-19 positivity rate, 5.6%, trending higher. COVID-19 activity is listed at very high. Hey, folks, Chicago is a very large city. It's a highly populated city. And take a look at this. Wastewater has absolutely exploded. Now, it looks like there could be one of those wonky movements. Regardless, I would treat this as if that is what's going on there right now and that COVID is very high. Better to be safe than sorry. And yeah, that's really high COVID levels showing up there in the Chicago area right now. All right, I wanted to continue with wastewater. Before we take a look at a few more sites, I got to show you this. This is emergency department visits. We're just going to quickly go through this. Emergency department visits diagnosed with COVID. It updated, and there's a lot of places doing bad. United States continues to rise as a whole. Alabama's still going up. Alaska, you're bouncing around. You're dropping a little bit. Arizona's rising. Arkansas is rising, and maybe starting to slow off. California is still rising. Colorado rising. Connecticut, yeah, you're still rising somewhat. Delaware, still issues for you. Washington has dropped a little bit. Now draw your attention to Florida. You can see there's where that potential peak was a few weeks ago. Ever since then, Florida is going straight upward. I should almost show you the full picture. You know what? I am going to. We're going to do this. I'm going to show you the full picture of Florida. And while we're waiting for that to come up, it takes a while sometimes. Let's pause and take a hydration break. Actually, it came right up. Let's pause for a hydration break, shall we? Juice is the drink of choice today. All right, I got to show this to you. You can see here, back August 3rd, it started to slow off. Then around August 10th, well, look at this. It went up. Then it tried to slow. And then now, it is just literally going straight upward. Almost 3% of emergency department visits are being diagnosed with COVID in Florida at this time. Yeah, that's not good whatsoever. That's really bad. Your schools are already open, too. Georgia continuing to go up. Guam is going down. Hawaii, looks like you are starting to peak at this time. Hopefully that holds true. I think it will. You've been rising for quite some time. Idaho going up. Illinois, Indiana, Iowa, all going up at this time. Kansas going up. Kentucky. Louisiana still. That's another one that's really bad. Maine, yeah, a little bit of a rise there. Maryland going up. Massachusetts has slowed off a little bit. Same with Michigan. Mississippi still going off. Maybe you will peak soon and stop going up. Montana, a little bouncing around there. Nebraska dropping somewhat. Nevada still going up. New Hampshire has slowed off. New Jersey still going up. New Mexico has slowed but still rising. New York has slowed a little bit. North Carolina, wow, that's another one that's starting to go straight upward. North Dakota is dropping a little bit. Ohio is slowing down a little bit. Oregon still rising. Pennsylvania still rising but slowing slightly. Rhode Island still rising. South Carolina is still going up. South Dakota has slowed off a little bit. Tennessee is still going upward. Texas, wow. Texas is now literally going straight upward. When things go up that fast, sometimes it indicates a peak could be coming soon. If we see that again on a Friday update, that is really concerning. Look how fast that's going up. That means there's just a huge volume of people testing positive for COVID at a really quick in Texas, just based on that metric alone. If we had more complete wastewater, I would like to see what it shows in Texas. Utah is bouncing a little bit. Vermont's dropping, and to be honest with you, I don't know why Vermont dropped a little bit. We're going to get a small sample size of wastewater in just a little bit. It's not going to tell us the story for the whole state, but you'll see. Vermont wastewater has some problems at 2 wastewater sites. Virginia rising. Washington has slowed off. That may go up again. We'll see. Virginia is still, West Virginia, I should say, still rising, and Wisconsin is still rising. All right, let's take a look at wastewater. And first off, look at the nationwide. We're high across the entire country. Let's go up to Vermont. Yeah, you're seeing 2 orange, which means 2 high wastewater sites. Take a look at Montpelier, Vermont. Things are starting to go up there. That could translate to an increase in emergency department visits soon. Mind you, we don't have southern Vermont on this. Look at Essex Junction. This is near Burlington, Vermont. You can see here, it was starting to rise and then whoop, straight up. However, X that out. It's one of those wonky data movements. Nonetheless, even if you X that out, it's still, things are rising there. Now, you saw me have Bridgewater, New Jersey listed on here. Yeah, because of that. I'll show you what that's doing. You can see it is listed high. How's the norovirus situation? Yeah, that's still going upward. COVID is high there at this time. There was somewhere else we wanted to look at in Newark. School's starting up there pretty soon. Newark, New Jersey continues to rise for COVID at this time. Let's go out to the West Coast. Let's see what's going on there. Oh, where do we want to go in the West Coast? Yes, let's go up close. Santa Cruz, California. What is going on there? I got a feeling that's rising. Well, it was. Now it's slowed off a little bit, and some slight dropping going on there at this time. Hi for COVID. Do you have a norovirus issue? No, you do not, but you did back in July. I missed that one. Let's go somewhere northwest. Let's go and see what's going on in Snohomish, Washington. Let's see. Their COVID levels is dropping slightly. And how about their norovirus? It's rising ever so slightly, but good to see this dropping. And that could indicate maybe emergency department visits will actually start to drop there. All right, take a look at Alabama. Yeah, Alabama is dealing with a lot of high wastewater sites. Birmingham area. Wow, look at this. It is really going upward there at this time. And of course, Florida, still problems across the board. Let's take a look here. Let's go to northwest Orange County, Florida. Let's see what's going on there. Yeah, need I say any more? COVID still going up. Alrighty, folks, that does it for the Tuesday edition of the Virus Update. If you enjoyed today's update, give it a thumbs up, subscribe down below, hit that notification bell, share this video with anyone you know, leave your comments down below. I'll be a little delayed with the comments today. Got to go out and work some this afternoon. But, yeah, I'll get to them as soon as possible. Ways to support the channel are listed down below. I will see everyone again tomorrow. Until I see you again tomorrow, stay safe, everyone, and have a fantastic Tuesday afternoon. Thanks for watching.